Good afternoon, everyone. Today, we are going to discuss the research we have conducted around nurses working with a mental illness and the repercussions it has on their work performance. Nursing is a very rewarding and gratifying occupation. However, it is also considered a highly stressful occupation as nurses often face negative factors such as an increased workload and physical demands, management issues, and lack of resources. Unfortunately, these factors create a negative work environment for nurses that has been recognized to result in poor physical and mental well-being among nurses. In the year 2020, 1 in 3 nurses reported symptoms of major depressive disorder, and more than 1 in 4 reported generalized anxiety disorder and clinical burnout. The significantly high prevalence of nurses with poor mental health leads to decreased job satisfaction, which in turn decreases work performance and productivity. Can you think of a time where you have experienced clinical burnout within the last 3 years of nursing school? Although there's a significant amount of knowledge around nurses with a mental illness, there's little to no research studies that have identified the repercussions that a nurse's mental illness can have within their scope of practice. This knowledge gap is concerning as it is not understood how the mental health of nurses can affect their work performance and possibly affect the outcomes of patients' care. With this knowledge, we have decided to conduct further research to investigate how a nurse's mental illness directly affects their work performance and patient outcomes. Specifically, the research question that is going to be explored is from the perspective of nurses, what effect does poor mental health have on their work performance?
The protocol that we followed when conducting our research is outlined within our infographic in the methods section. Specifically, when conducting our research, we used multiple databases, and when typing into the search engines, we used keywords like mental illness, nurse, and quality of care. Our inclusion criteria that we followed when selecting the articles was that we ensured that the research was written and or translated to English and was relevant to our current practice by ensuring the studies were conducted within the last 5 years. Our exclusion criteria was not very strict as we wanted to ensure that the research was diverse. Lastly, we used the CASP and McMaster tools to critically appraise the research articles. Within the findings section of our infographic, it is mentioned that while conducting research to answer a question, we decided to look for a minimum of 10 primary scholarly peer-reviewed articles to ensure that we could gather information from a variety of different sources and areas of the world. Overall, we found 12 articles that met our criteria and that provided information to our question. While conducting the research, it became relevant that mental illness among nurses is very prevalent. Findings that were common among the majority of the articles included the fact that working with a mental illness as a nurse, if not treated properly, can result in work dissatisfaction, medical errors, lack of productivity, and overall decreases in work performance. This can have a major impact on nursing practice as nurses need to be aware of their mental health to ensure that the care that is given is not affected. Based on our findings, we've come up with recommendations to improve education, nursing practice, and research. One of the impeding elements to nurses' mental health is the lack of education and awareness about the prevalence of mental illness among nurses. This lack of awareness can contribute to stigma that revolves around mental illness. How would you feel if you were told that the nurse providing your care had a mental illness? Would you view them as less competent in their practice, or would this influence your view of them and the healthcare system? Adding additional education about mental illness will help to eliminate these stigmas and foster resiliency throughout the awareness of mental health. Education and the importance of mental health among nurses can significantly impact students' current and future mental health. Although there is already basic education taught in schools about mental illness, there is not enough. By providing enough depth and exposure to individuals with mental illness, a more positive attitude towards mental illness among nurses could be expected. Discovering the extent of stigma is fundamental to gain insight into stereotypes and can address and further clarify the prevalence of mental illness among nurses. With regards to nursing practice, our recommendations include bringing about organizational awareness and the implementation of help resources. The number of resources available for nurses with poor mental health is low. As discussed previously, many mental illnesses arise from poor work conditions. By assessing the employee's mental well-being, organizations can allow for employers to gain insight on organizational factors that are hindering the employer's mental health. This will allow them to come up with strategies to enhance the performance of employees and to avoid negative work performance and absences. Organizations can also develop support strategies and interventions for nurses with poor mental health to address the psychological and physical exhaustion related to mental states. This can allow for assistance with educating nurses on recognizing mental illness symptoms and to promote self-awareness.
Nursing research is the basis of practice and creates the evidence needed for nurses to provide the best quality of care for patients. But why is there no research to help people who have dedicated their lives to helping others? We know that mental illness is becoming increasingly more prevalent among the nursing profession, but further research must be conducted in order to come up with solutions to fix this problem. At the bottom of our infographic, we have included some direct quotes from nurses working with a mental illness, discussing their feelings and experiences in regards to their work environment. As you can see, these quotes display a lack of job satisfaction, which can in turn result in decreased work productivity. In knowing this, conducting further research of this topic from the perception of nurses would allow for organizations to identify the basic needs of nurses. Having an identification of these needs will allow organizations to create appropriate tools and resources that can be utilized by nurses to preserve their mental health and prevent poor patient outcomes. Thank you for listening to our presentation about the need for increased education on mental illness among nurses, implication for nursing practice, and the need for further research. At the bottom of our infographic, we have listed our references.
To end out this presentation, we have 2 questions for you. Have you experienced any symptoms of burnout within the past 3.5 years of nursing school? And what would you do if you were told that the nurse providing your care had a mental illness?